The Health Secretary has defended his handling of the pandemic and denied explosive claims he ever lied to the Prime Minister. That allegation was made by Boris Johnson's former advisor, Dominic Cummings. But during almost 4 hours of evidence to MPs, Matt Hancock said it was telling that Mr Cummings hadn't followed up his claims with proof. Mr Hancock had also pushed back hard on a claim he made earlier in the pandemic that a protective ring would be put around care homes to prevent a high number of deaths among the elderly. His response was simple and sombre: "We tried." More on that in a moment. Let's take you through some of the key pieces of evidence Mr Hancock gave to MPs. He denied Dominic Cummings' claim that he had repeatedly lied to the Prime Minister throughout the pandemic, saying he always acted with honesty and integrity. Mr Hancock also said that the government had followed clinical advice on discharging patients from hospital into care homes and said that every care home death weighed heavily. The Health Secretary said he regrets not challenging advice from the government's scientific advisor, SAGE, that the public wouldn't comply with lockdown rules, which led to a delay in the country locking down. And he acknowledged that getting hold of enough personal protective equipment, or PPE, had been a challenge, but denied there was ever a shortage. First, though, the question of whether the Health Secretary had told untruths.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
Thank you. And specifically, in terms of the particular points that Dominic Cummings raised, first, did you say that everyone who needed treatment got the treatment that they required when you'd been told by the Chief Scientific Advisor and the Chief Medical Officer that people did not get the treatment that they deserved?
I did absolutely say, both in private and in public, that everybody got the COVID treatment that they needed. And I'm very proud of the fact that with the NHS, we delivered on that during the pandemic because it was critical.
Well, that earlier evidence from the Prime Minister's former advisor, Dominic Cummings, loomed large over today's proceedings. He was asked to comment earlier on Mr Hancock's evidence.
When are you going to provide the evidence for the allegations you have against the Health Secretary, Mr Louis?
So, no response from Dominic Cummings, but his claim that he repeatedly called for the sacking of Matt Hancock was brought up today, with the Health Secretary quizzed over why there appeared to be so much animosity between the pair.
I have no idea. I mean, I worked directly with the Prime Minister from the start of this. And, of course, I worked with his aides and his team as well. And I have no idea.
Did you know that he wanted the Prime Minister to fire you?
Yes, because he briefed the newspapers at the time.
Right.
Or somebody briefed the newspapers. I now have a better idea of who it was.
And did you raise an objection to that?
Yes, of course, and I had the Prime Minister's wholesome support all the way through.
Well, let's speak to our Deputy Political Editor, Sam Coates, who's here. Sam, this was the Health Secretary's chance to defend himself, defend his handling of the pandemic and to come back against those explosive claims made by Dominic Cummings. How did he do?
Well, there was two parts to today's session, really. There was the agenda as dictated by Dominic Cummings in his explosive evidence session a few weeks ago. And on those issues, as you heard, really the committee didn't get any joy. They didn't get any specific answers. Matt Hancock rejected the claims of Dominic Cummings. And effectively, the committee allowed him to move on. The real meat of today's session, however, were the questions that the committee had about the serious challenges, even perhaps the errors that the government made in the handling of the pandemic. And across 4.25 hours, Matt Hancock was drawn out in detail on those things. The charge sheet against government, even from this committee, which has two Conservative chairs, appears pretty substantial. The committee fears that the country locked down too late last year, that there wasn't the testing capacity, and probably put people back in care homes even though they were testing positive from hospital. Matt Hancock didn't really reject those claims outright, instead appeared to try and want to explain, contextualise, in some cases point the finger of blame. There's a lot in there, I think, that will be chewed over for some time to come. One of the most extraordinary things he revealed was that right at the end of January, so nearly 2 months before the country locked down, he got advice that under the worst case scenario, there could be over 200,000 deaths. 820,000 deaths based on modelling. Let's hear what Matt Hancock said he was told at the end of January 2020.
The challenge in those early weeks of March was making a massive judgment, probably the most significant judgment that any Prime Minister has made, certainly in peacetime, based on incomplete information and at great pace. So I instructed the department and the health system to plan on the basis of a reasonable worst-case scenario in January, in fact on the 27th of January. And I asked for a reasonable worst-case scenario planning assumption. And I was given the planning assumption based on Spanish flu, and it was signed off at Cobra on the 31st of January. And that was a planning assumption for 820,000 deaths. And I was determined that that would not happen on my watch.
Sam, this is a lessons learned committee hearing. What did the Health Secretary say about where he thinks things went wrong?
Well, it was interesting. There were lots of different places where the blame lies, not all of it, or not much of it, it would seem, in his department. For instance, he blamed the global scientific consensus that suggested, he said, until early March, that there was no asymptomatic transmission from coronavirus. Listen to what he said on that.
The WHO's position was that, and I quote, there has been no documented asymptomatic transmission. Now, as I say, given all of this and this debate, and it's an absolutely accurate reflection of the debate, I regret that I should have stuck with my guns and said, well, there is, even if it's uncertain and even if it's relatively small, we should base policy on that, because even though the formal advice I was receiving was that asymptomatic transmission is unlikely and we shouldn't base policy on it. And that was, and I should have overruled that.
So Matt Hancock saying slow to lock down because of the global scientific consensus. Worth saying, of course, that the SAGE advice was pointing out that there was transmission without symptoms as early as late January. So I suspect that claim will come under scrutiny. Matt Hancock also said that he should have challenged the consensus on SAGE, the UK government advisory body, that you couldn't really do lockdowns in the UK in the same way that you could in Asia. I think that one of the two key areas also that will be picked over will be his claim that despite all of the problems with PPE, there was never a national problem with it, just some local supply issues. And he also claimed that that didn't lead to anyone dying. I think there'll be a lot of focus on that. And he also appeared to play down the problem of infections in care homes from hospitals. You'll remember many patients sent home at the start of the pandemic in order to free up beds in hospitals, only to find then that care homes saw a lot of cases of coronavirus. He insisted that something like only 1.6% of cases actually came from hospitals. Greg Clark, one of the co-chairs of the committee, really challenging him on that figure, suggesting that a lack of data meant that the figure looked lower than it really was. So lots of different issues to chew apart. It wasn't as explosive as Dominic Cummings set up today's session to be, but the nature of the pandemic, its complexity, means that actually to get to the heart of the issues, you needed a much more detailed session like the 4.25 hour one that we had today.